Hello, everyone, and welcome to the latest in our We Are Gaucher webinar series. The International Gaucher Day 2020 is on the 1st of October. This important day of the year is an opportunity to shine a spotlight for the Gaucher community, celebrate its achievements, and tell the stories of those affected by this disease around the world. In the lead up to International Gaucher 2020, we have hosting several webinars as part of our series, and we are happy that you have decided to join the conversation. Today, we welcome Atif, Qureshi, President of the Lysosomal Storage Disorders in Pakistan. We will discuss the patient advocacy in developing countries and touch on the following subjects: the Lysosomal Storage Disorder Society in Pakistan, mission and goals, an overview of Gaucher disease patients in Pakistan, and the activities of the Lysosomal Storage Disorder Society in Pakistan. If you have any questions, please enter them into the Q&A chat, and we will come back to them at the end of the presentation. So, Mr. Atif, whenever you want.
Yeah, thank you. Thank you very much, Jordi. And thank you, Sendojin, for organizing these series of informative webinars and events for the Gaucher Awareness Day. So before we start, yes, I'm Atif Qureshi, and I'm the president of Lysosomal Storage Disorder Society, Pakistan. And LSD Society, before getting into the presentation, I feel it's really very important to give a kind of a holistic view of the situation here in Pakistan that is very relevant in context of our presentation for the audience. So I strongly believe. So just few quick facts about Pakistan. So Pakistan is the fifth largest population. It has a population over 220 million people, and it is the 33rd largest country by area, spanning around 881,913 square kilometers. It is a beautiful country. It has beautiful landscapes and mountain ranges and scenic views, and most importantly, amazing people. But there are other important aspects. Pakistan, in some studies, for total population of Pakistan, 40% of the population lives under the poverty line. It means that 4 out of 10 people in Pakistan living in acute poverty. And Pakistan is also facing multiple economic challenges, a constantly growing population, and economic challenges also linked with the lack of job opportunities and high literacy. So when it comes to health, the total health expenditures as a percentage of GDP in 2018-19, the spending was only 1.1%, which is even less than the previous year, where the spending was 1.2%. So you can well imagine what could the health condition would be in the country. And before going forward further, there's a widespread of prevalence of intermarriages in Pakistan. Means that our population is at a greater risk of rare genetic diseases. As in West, the normal incidence of rare disease is reported as 1 in 5,000 births. But in populations in countries where intermarriage rates are higher, this incident rate goes a lot higher in alarming ways, in many folds. For instance, in Qatar, the prevalence is 1 in 1,300 births. So we can compare from the West. And the intermarriage rate in Qatar is 40%. But when it comes to Pakistan, we don't have any kind of definition in terms of rare disease, the prevalence so far. But we do have the number, the average or the number of intermarriages that is much more higher than Qatar. It's almost 60%. So we are at a greater risk of rare genetic diseases. And so far we have identified the rare disease patients. It's just the tip of the iceberg, how I define it. So moving on, the LSD Society Pakistan is a registered not-for-profit organization. It is formed by the parents and the patients who are dedicated and committed to improve the lives of the lysosomal storage disorders patients in Pakistan by advocating the patient rights and creating awareness and general general public. So these are parents and patients, so they exactly know what it feels, what it like to be living with a rare disease. So we currently have 10 members team. They all are volunteers. There are no, we don't have any paid employees so far. So just to take you to the background, as like many other patient advocates, I have a personal connection with the rare disease. I came into the rare disease space when my daughter was diagnosed with Gaucher disease, and my own personal experience in terms of her journey was very difficult and very teething and long. When my daughter was 1.5 years old, she started showing the typical symptoms of Gaucher disease, and we took her to almost all the you know renowned pediatricians and all the bigger hospitals available in our country to finding our answers what is wrong with her. But unfortunately, for first 8 months, we were moving around, we were roaming around, there weren't any answers. And there was a stage when she started when we started blood transfusions because of her platelet count and HP levels goes really down, and her spleen was massively enlarged. Then one of the physician advised me to uh, identify this, to track this. We need to have bone marrow biopsy, and that was the first time when Gaucher cells were seen in the bone marrow biopsy. So it also indicated that yes, there is something seriously wrong with her. But that our ordeal or our audacity doesn't actually stop there or end there. That is in fact started actually from there, because when we realized the diagnosis, we came to know that for confirmatory diagnosis there needs to be an enzyme assay analysis. So unfortunately, enzyme assay analysis, we checked with all the local labs. That the enzyme assay analysis wasn't available in Pakistan in any of the labs. So I tried so hard, and finally, one of my family member who was settled in the UK, and I sent the blood samples there for enzyme assay analysis, and the result came as Gaucher positive. That was the time we came with a confirmatory diagnosis. But the next stage was when we realized that yes, we have the diagnosis. Now, what is the next step? The next step was to offer the treatment. But unfortunately, the cost of the treatment was way too high. No one can afford that. And obviously, it is not available in Pakistan. So, you know what? I understand that there are families and there are parents with the rare diseases where there is no treatment. It is extremely painful. This feeling cannot be explained in the word. But with my personal experience, I think it's a worse feeling when you came to know that your kid is sick and there's a treatment available which is accessible by other families and other parents in other parts of the world. But unfortunately, you can't have that treatment because of the costs of the treatment or because you are not living in one of the developed countries, unfortunately. So that's even worse kind of feeling. Anyways, I was very fortunate that I got in touch with Qureshi Association UK, who navigated me through the process, and my daughter was got enrolled in charitable access program run by one of the pharmaceutical company, and she was the sixth patient who got on charitable access program from Pakistan. So the next step was actually to import that medicine in Pakistan. We thought that we've done the hard work and the next would be much more easy. But when we started importing the medicine, we realized there is a huge gap in terms of importing the medicine, because there is no import policy for rare disease medicine import. There are hefty taxes and duties on the import of every medicine. That was very difficult and long and tedious process. So in during that process, I got in touch with few other families who were diagnosed with Gaucher disease, and we tried to actually help them with the treatment. And unfortunately, during that period, the charitable access program was capped, and we lost 3 lives during the period of like 2010 to 12, unfortunately, which I've seen. So during that time period, my younger daughter also started showing these symptoms, and so since I had a worse experience of diagnosis with my own elder daughter, but through that journey, I've learned my lesson, and it was much more easy for me to, get my younger daughter diagnosed. It was much more easy without any complications. I knew exactly what to do. I knew that I don't have to go through the bone marrow biopsy, the painful process. I can simply go with an enzyme assay, and I knew that how it needs to be done. So unfortunately, that charitable access program was capped, so she wasn't got enrolled in that program. These are the pictures on the right, both of my daughters. So during that period, when we realized that there are many other patients who are diagnosed and are dying for not having the treatment, we've decided that we can't, go along that the way it is. We need to take control of the situation. We need to take responsibility as parents, as a patient, as a community, as a society. So we first step we took was we gathered all the Gaucher families who were diagnosed in Pakistan, and we had our first Gaucher meeting in 2012. We gathered all the families and we shared what are the common challenges, and we tried to connect each family so that they could share their journey, their experience with Gaucher disease, and we could form a future strategy how to go about it, how the import process, how we can simplify the diagnosis, how we can help other families not to go through the same process which we have already done. Let's simplify process for them. Let's make their life much more easier. So we nominated few contact points in different cities so that we would be more accessible for the new Gaucher families, and we could, share the information resources from those points. And during that period, the Children's Hospital Lahore has started different clinics for rare diseases with support of International Gaucher Alliance. We also joined those clinics during 2013 and 2014. And we also conducted different press conferences to sensitize non-availability of treatment and the diagnosis challenge every family is facing in Pakistan. But during those clinics, we realized that as a Gaucher community, we are still a lot better than the other communities. We are connected. We at least have identified few of the resources which can kind of work as a resource, information resource, and can ease out the process for the families. But there are other LSDs who really doesn't have any kind of representation. So we decided rather than a one disease specific patient group, we can cover lysosomal storage disorder and become a bigger group. That bigger group will help us in having a strong voice and in terms of pressurizing or sensitizing our challenges, since we are facing the similar challenges. So that's how this idea of becoming a lysosomal storage disorder group has came. And we set our aims and objectives, and we got ourselves registered in February 2018 as the first rare disease patient support group in Pakistan. So our aims and objectives are clear. We are here to campaign for effective and safe therapies for lysosomal storage disorders commonly diagnosed in Pakistan, which are Gaucher, MNPEC, and MPS. We strive to provide information and support to all patients, their families, and whoever have interest in lysosomal storage disorders. And to provide information, support, genetic counseling to all affected patients and families. This is really very important because we have many families in Pakistan who really don't understand how genetic works in these diseases, rare diseases, especially in autosomal recessive diseases. So this is very important mission we are having, an objective we are having, that we need to educate our general public about the genetic counseling, the genetic aspect of the disease. Then we also have to educate our general public regarding the causes of inborn disorders, how to prevent these disorders through seminars and conferences, and to help treatable patients to access treatable treatments within reasonable time frame. This is also one of our objectives, because especially in Gaucher, the delay of the treatment causes some damages to the patient, which cannot be even reversed with the enzyme replacement therapy. So early treatment availability is also a main objective which we're working for. So when we established ourselves as a patient support group, the first thing we have clear in our mind that we need to have collaboration. We need to learn from others because our challenges are unique. Our situation is unique. So as more of international collaborations we have, the much more focus we are going to have and much more support we are going to have for our community, for our local community. So since we are already working with International Grocery Alliance, we became the registered member of International Grocery Alliance in 2018, and we became the LSD Society, became the registered founder alliance member of Global Genes in 2018, the same year. We are in coordination with National MPS Society and National Olympic Alliance for future collaborations, and hopefully will become their member as well. We also collaborated with Centogene for different clinics they are conducting in Pakistan and the rare disease events like this one. And we also partnered with Centogene for the pilot run of My LSD app, which I'll be covering in next few slides. So as a registered patient support group, the first thing what we did was the first event which we planned was we conducted LSD awareness seminar. It was in collaboration with one of the media house and one of the local one of the pharmaceutical company who's involved in treatment of Gaucher disease, and that was in 8th of April. The idea was to bring all the main stakeholders under one roof. It is the physicians, the patients, the patient support group, the government officials, and the physicians, and obviously the media as well, and the pharmacy, their representation as well. So we can sit together, we can share the challenges, and we can make a strategy how we can effectively overcome these challenges and make these treatments and the other support treatments available for the patients and families. Another important aspect which was always in our consideration was the import process, which is always lengthy, complicated. To ease the process for the families, we started coordinating with some of the government officials, and we tried to brief them how challenging it is for the families to bring the treatment which costs millions of dollars is for the patients. The companies are sending it, so we need to ease out the process for the families to to get that treatment. So we got the import of Cerazine exempted from Punjab infrastructure tax, which was a huge tax on import of this medicine. So that is one of the kind of achievement which we have as a patient support group. Another important area which we identified to reach out for our community was actually Facebook. Because Facebook is very commonly used by our families here in Pakistan, and this is the most easy and accessible social media application families are using. So we decided to be more visible or use this medium to reach out for our community. So we formed the Lysosomal Storage Disorder Families Facebook page, and it has been an amazing experience by creating that page, because there were so many members who joined us through our Facebook page. And at the same time, it also enhanced our visibility internationally, because there are international organizations who started referring patients to us who were directly tried to coordinating with them or seeking help from international organizations. And it also helped in improving LSD registry, which we are maintaining at Lahore Children's Hospital, because there are other patients who are either get their diagnosis through their own efforts by sending the blood samples to international labs, or there are other centers who are helping the patients with diagnosis. So one of the key area which we cover through our Facebook page is we connect those patients with already registered patients of registry, which is being maintained at Children's Hospital. We connect those patients with our team at Children's Hospital. Another experiment which we did was literature. This medical literature is very complicated to understand for, say, some of the families. So we try to simplify that literature through our Facebook medium. We try to translate that into our native language. And this experiment was extremely successful because there is a lot of engagement on our posts which are in the native language. And people, started to ask questions and have a better understanding about the disease and how it impacts. So when we formed as a patient support group, we realized that uh, we the patient support group with the idea of covering the covering the Gaucher disease only. Then we expanded as lysosomal storage disorder, and still we are uh, getting the request and queries from different other patients who are diagnosed with other rare diseases. Like recently, we have been approached by one of the patients who doesn't have any diagnosis, and they were like very confused what to do and how we can get our diagnosis and how are we going to get our answers. We helped them in diagnosis, and their diagnosis was Canavan disease. The father was pretty active, so we are now empowering him to set up a patient support group for Canavan disease in Pakistan. We've already connected them with the international foundation, Canavan Foundation. We are already working with one of the physicians in our farm who's working for muscular dystrophy patients. And there is another mother in Islamabad, in our capital, who is a single mother with a patient limited muscular dystrophy. So we are connecting them all together, and with another international foundation, Jane Foundation, which is already working in the same domain. So that's how we are trying to empower our patients with apart from the LSD spectrum. We want other rare diseases to be have their patient support groups and to be active for their communities. So when we formed this page, we started receiving the queries not only from different other rare diseases but from different other countries as well. Like we received queries from Bangladesh for the treatment. Some of the patients approached us, and especially from Afghanistan. There are a lot of patients who approach us through Afghanistan because I think probably there is much more easier to travel from Afghanistan to Pakistan, and we have a better healthcare system, at least than Afghanistan. So one of the family who approached us was Yasir Shafiullah, and he has no diagnosis. He approached us from Afghanistan, and he wanted to set a platform here in Pakistan so that his kid can be diagnosed here in Pakistan. So we made that arrangement, and later on he was diagnosed with a name in PIC. Unfortunately, that kid didn't survive. There is another patient who was diagnosed with Gaucher disease, but he moved to Afghanistan with the hope that he might get the treatment there. And he waited for like 2 months, and then he again contacted us and for the support. And he even approached our Indian counterparts, but unfortunately, there wasn't anything made available from either in Afghanistan or India. Then when we asked them to move back to Pakistan, and the kid is now on enzyme replacement therapy thanks to Department of Gastroenterology Children's Hospital. We recently had one of the patient who is diagnosed with MPS 1 for the enrollment in International Charitable Access Program, and that kid is now going to get the enzymes, which we are extremely happy about. We actually played our part in that. So moving on, since we are talking about the Gaucher awareness, so this graph actually shows these are the numbers which are available with our registry maintained at Department of Gastroenterology Children's Hospital. So the first patient diagnosed in Pakistan was in 1998, and when my daughter was diagnosed in 2010, there were like only 8 patients in Pakistan which were diagnosed with Gaucher disease. And just look at the graph going upwards. When we started advocating, and when the children's hospital started doing clinics and facilitating the patients with the diagnosis. So within a span of like first 12 years, we only had 8 patients, and next 10 years we are already 326 patients. And the biggest hike is that when Centogene started facilitating the patients with the diagnosis in 2018 and 19, during that period, we diagnosed more than 100 Gaucher patients in just 1 year. So you can well imagine the number of patients we have. The actual number of patients could be huge. It could be very high in Pakistan. So as I said earlier, that we collaborated with Centogene for MyLSD app in Pakistan and for the pilot run. So it's an amazing app because it gives you not only the clinical side but behavioral side as well. And for clinical side, we normally assess the physical appearance of the patient, but this lysosomal GB1 biomarker, which actually gives you the effectiveness of the treatment and the disease progression as well. So total lyso-Gb1 biomarker which are being sent by Pakistani patients to Centogene were 118 total analysis being conducted, and the results ranges from 68 to 308 nanogram per milliliter, and the mean value is 151.67, which is again on the higher side. And I can relate to that because 308 and 292, which are the highest values, are no other than my own daughter, my younger daughter, which is on partial therapy. She's not on complete therapy. And the number is because during the COVID period, we skipped some of the therapies intentionally because we weren't aware that what was going to happen. So as a contingency plan, we skipped some of the therapy so that we can continue with the enzyme replacement therapy. And another thing, so apart from in lyso-Gb1 biomarker, another thing which is covered through that app is the behavioral aspect. So you normally cover, the clinical aspect through, different other assessments, but behavior is something which is really very important, and it, in my experience, it plays a vital role in terms of identifying the disease progression and how disease is impacting the patient. So there are quality of life surveys on the app. By using it, you can get an altogether different aspect of the disease. So there are three main areas which these surveys covers. One is health, the pain, and the mood of the patient. There are different scales based on that. They evaluate the health and pain and mood of the patient. So there are, in health, the scale is 1 to 100, and in pain, the scale is 0 to 10, and for mood, the scale is 0 to 63. In Pakistani patients, you can actually relate to that graph. Look at this graph. It gives you a complete different, a kind of scattered graph. So some lines are going upwards, some are going downwards. So this actually shows that how the disease is impacting a patient in different ways. No two patients can be related or compared. Even my daughters with the same genetic mutation, they are entirely different from each other. So in both in pain, behavior, their general health, and their mood, everything is different from each other. So this graph actually shows you the same. So there are 48 entries so far from Pakistan. The mean value is 68.45 points, and the range is between 45 to 96 when it comes to general health of the patients, how they responded to those health surveys. For the pain, there are 54 entries. The mean value is 1.96, the average, and the range is between 0 to 6, 10 being the highest. And for depression and the mood, the analysis shows that out of 54 entries, the mean value is 5.7 points, and the range is from 0 to 31 points. And this data is, we started collaborating with Centogene since 2018 November, and this is the updated data so far. So moving forward, I would like to share some of the general challenges which we are facing as a patient support group in Pakistan. Some of these points are already being covered, but so the one is the low literacy rate and the generally poor background of the patients and affected families. That makes it really very difficult for them to get the follow-ups because of long distances and financial burden of the disease. And there are many families which we came across who just gave up the follow-ups, who just gave up the hope, and who just stop following up and coming to the clinics just because they are not getting the treatment and getting therapy. So, and this is a huge challenge to make them relevant, to make them motivated to come to the clinics and come to the follow-ups. And unfortunately, there is no rare disease policy. So this is the major area. Most of our patients who are diagnosed are rely on charitable access aid because There is no program run by the government to facilitate the treatment of the patients. We don't have any healthcare specialized centers and trained professionals except for one genetic center at Department of Gastroenterology, Children's Hospital, Lahore, because that's the only center in the country where all the patients are referred. And obviously, this one center is not feasible because there are patients from all across the country who are coming to one center, and there are limitations in terms of center as well. They can't, take the burden of the whole country. We need to replicate this kind of idea, this kind of concept in other cities, and at least in the main cities, so that the number of patients can be divided in other cities. We still don't have the diagnostic facility. And my daughter was diagnosed in 2010. Till date, we don't have any of the lab conducting these tests locally. So we're still sending the blood samples abroad through our international collaborations. As I said, only 1.1% is allocated for the health budget. So you can well imagine the rare disease is obviously not in the focus at all. Import of the medicine is still a huge challenge because the medicine clearance process normally takes months and months. And obviously these medicines are temperature sensitive. At the same time, it has certain expiry. So we can't just leave these medicines for a longer period of time at the airports. So that is another challenge, to ease out the process of import, how we can easily, conveniently import the medicine at the earliest possible time. Yes, the patient advocacy is a misunderstood concept, unfortunately. Still, people have different kind of misconceptions about patient advocates. When we go to different, officials, and we talk about the patients and their challenges, they normally, expect the family member, the immediate family member, to raise voice, to come forward with their concerns. So either they ask us what in it for you, or kind of, perception we are getting that they have this, that the patient advocate is doing it for some kind of benefit for their own self. Another challenge is the lack of volunteering in the rare disease advocacy. Uh, we have, unfortunately, this tendency that most of the patients and the parents whose kids are diagnosed with any of the rare disease, if they get the therapy, they put themselves aside from all the main activities. They go back to their normal routine lives. They think that, okay, this was one kind of event that had happened. It will not going to happen to us again. So they don't play the active part in sort of advocacy or raising voice for others. So unfortunately, this is another challenge which we are experiencing, and in some cases where the unfortunate kid don't survive or die because of any rare disease, the family again disconnect themselves. They consider that it was one of the event and it won't going to happen again. And unfortunately, with the next birth, most of them come to the clinics again, and they don't realize how the genetic works in the rare diseases. So this is my last slide. I would like to share some of the future plans which we are planning to execute as a patient support group, which we feel like will make us more kind of vibrant patient group and more effective patient group. We are planning to create more chapters in other cities of Pakistan so that we would be more accessible to our community, and we would have better access, uh, and they would have better access to their information and resources. Another aspect which we are focusing on is the patient meetings, family meetings, because the disease, the parents do, get to know each other. They come to different clinics, they come to different conferences and seminars, but unfortunately, those conferences and seminars are very focused on the medicine, the medical aspects of the disease. But there is an emotional element which is really very important as it is also a part of the disease. So for that, we need to have separate family meetings where families could have their separate times. They can, get in touch with each other. They can share their experience. They can that emotional support is should be there. We have also learned that for communication with our families and amongst the families, WhatsApp is the most effective tool. So we are also planning to create WhatsApp groups for families with a similar disorder so that they can share their experience and their challenges. And at the same time, we also planning to start a kind of peer-to-peer initiative where we want to, our resourceful families, our well-educated families, to own one family who has a poor background, who have, kind of less information about the disease, so that they can, help them out on the journey all along. We are also coordinating with ZP Foundation for inclusion of birth screening of most common LSDs. Uh, September was the birth screening awareness month. So yes, this is also something which we are considering. If they can include these panels, so we can at least have a diagnosis at the earliest possible time, because the early the diagnosis is, the better it is, because the patient management also depends on the early diagnosis. Then we are planning for both horizontal and vertical diversification of our organization. By horizontal diversification, it means that we are supporting, patients and parents of rare or specific disease to form their own disease groups. Because this will not only help in more focused groups, but it will help in better registries to attract research and open access to clinical trials for our patient community as well. Then vertically, we want to expand as a parent organization, which could cover all rare diseases, so that we have a stronger voice. We could give platform to other rare diseases as well, so that we can have, advocate better for the rare disease policy and for the education and treatment of the patients here in Pakistan. So before closing this, I just want to share the philosophy which we all share. We cannot maybe move the mountains, but yes, we can at least exert the effort. So we are, the results are not in our control, but at least the effort is. So that's the philosophy our patient group is working with. Thank you. Over to you, Jody.
Thank you, Atif, for this very interesting presentation. And now let's move to the questions. The first question is, are there other patient organizations about rare diseases in Pakistan?
Jody, we are still in the process of exploring this, the other rare diseases. Unfortunately, if they are either working in silos, because there are rare disease events happening in the country, but there are no other patient support organizations we came across during those conferences. So yes, there is a possibility that there are patient support groups, but they are not, working in the mainstream. They're either very small groups, or there are very few groups, maybe, if they exist. I don't know much of the groups when it comes to rare diseases.
Mm-hmm. The next question is, how do you work to give access to the treatments to the patients with lysosomal storage disorders?
How do we work?
Yeah.
Well, well, it's really very, there are two sides to it. One is for the treatment, because not every patient is eligible for the treatment, because there are clinical aspects of the disease as well. So the physicians are and the panel of the physicians are the right ones to actually select the patients, and they also evaluate the effectiveness of the treatment on every patient. So what we do is we try to keep them engaged with the clinics and with the follow-ups. That's the most important, because there are opportunities coming our way. So we need to keep them linked and keep them relevant to this. So that's one part of it. Second is we also coordinate with international organizations who are working for that particular rare disease. So we also try to seek help from them in terms of treatment. Like the recent example I've shared during the presentation, one of the MPS1 patient who recently going to get the treatment, we raised their voice through Department of Gastroenterology and also through the International Gaucher Alliance. They both we actually make a team, and we joined hands and we tried, and it actually worked. for that particular patient. So that's how we operate.
Okay. So another question is, this data that you show around the number of Gaucher patients is only from Lahore? Is only from the Department of Pediatric in Lahore, where
Uh,
Professor
the
Chime is the head?
graph, the 362 patients, which is that what you're referring to? The Gaucher patients, the number of Gaucher
Yeah,
patients?
exactly. The total number.
Yeah, no, these are the patients who were reported from all Pakistan. It's not just the number from Lahore. These are the total patients of Gaucher disease diagnosed in Pakistan so far.
Okay. And do you have any idea about how many patients it is expected to have, for example, Pakistan, according to the population and the consanguinity?
Well, there can't be a wild guess for that, but obviously the prevalence is really very high because of our inter family marriages. The trend is on very high, and we are an inbred community. So the probability, as I said, it is just the tip of the iceberg. The actual number would be, what we fear is, would be very high. But giving any number, I'm not in a position actually to give you a number, but we fear that it would be high.
Okay, so the consanguinity is very known that it's influence in the rare diseases, so in the diagnosis. So there is any policy in Pakistan regarding the consanguinity and the marriage between relatives?
There isn't any law at the moment, but yes, there are other organizations who are working for testing before the marriages, and we also advocate for the same, that the carrier testing should be made available for the before the marriages, and especially from the diagnosed families. These tests should be made mandatory. There is already a program running in for the thalassemia patients, and we recently had a meeting with that program director, and we were actually asked them to collaborate with us to see how we can uh, be included in that program, and maybe we can have this pre-marriage testing could be made a law maybe, or should be made available for LSD patients as well.
Okay. So I think that yeah, we don't have any so yeah, we can finish. So thank you once again, Atif, for your time and your presentation. I think that it's very important your action there and your work. So do you want to to say the last words or anything that you want to remark?
I just want to thank again the whole team, Centogene, and for the support you guys are providing in terms of diagnosis, especially in Pakistan, and with the treatment, obviously. So I just wanted to say thank you from the rare disease community, Pakistan, for all the work you're doing. Thank you, and thank you for having us today.
Thank you.
Bye bye.
So thanks to all the participants for joining our We Are Gaucher webinar series, and we hope to see you on the next webinar tomorrow. We are also very welcome to join our International Gaucher Day Digital Conference that will take place on the 1st October. The registration is open, and we look forward to seeing you there. Lastly, we are going to launch a poll allowing you to give feedback and enable us to further improve our educational webinars. We would greatly appreciate if you could take a few minutes to fill it out. And once again, thank you and have a nice day. Bye.